Welcome to Mind Mentor. In this video, we will study HIV, human immunodeficiency virus, and AIDS, acquired immunodeficiency syndrome. These are two related but distinct medical conditions. Let's explore each of them in detail. HIV, human immunodeficiency virus. HIV is a virus that primarily attacks the immune system, specifically the CD4 cells, T cells of the immune system. CD4 cells are crucial for helping the body fight off infections. HIV weakens the immune system by reducing the number of these cells and impairing their function. It is transmitted through specific bodily fluids such as blood, semen, vaginal secretions, rectal fluids, breast milk, and to a much lesser extent, in saliva and tears. The most common modes of HIV transmission include 1. Unprotected sexual contact. This is the most common mode of transmission, especially among heterosexual and homosexual partners. 2. Sharing needles or syringes. HIV can be transmitted through the sharing of needles or syringes by injection drug users. 3. Mother-to-child transmission. HIV can be transmitted from an infected mother to her child during childbirth or through breastfeeding. 4. Blood transfusions and organ transplants. Although rare in developed countries due to rigorous screening, this was a significant mode of transmission in the past. 5. Occupational exposure. Healthcare workers may be at risk if they come into contact with infected blood through needle stick injuries or other accidents. Once someone becomes infected with HIV, the virus integrates into their genetic material and the person becomes HIV positive. However, not everyone who is HIV positive develops AIDS. AIDS, acquired immunodeficiency syndrome. AIDS is the final and most severe stage of HIV infection. It typically occurs when the immune system is severely damaged and the CD4 cell count drops significantly. A person is diagnosed with AIDS when their CD4 count falls below 200 cells per cubic millimeter of blood. A normal count for a healthy person is between 500 and 1/600 CD4 cells. Additionally, the presence of certain opportunistic infections or cancers can also lead to an AIDS diagnosis. AIDS is characterized by a weakened immune system, making the individual highly susceptible to a wide range of opportunistic infections and certain cancers. These conditions, which are typically controlled by a healthy immune system, can become life-threatening for someone with AIDS. Some common AIDS-related illnesses include tuberculosis, TB, pneumocystis pneumonia, PCP, Kaposi's sarcoma, cytomegalovirus, CMV, toxoplasmosis, and cryptococcal meningitis. It's important to note that the progression from HIV to AIDS can take many years, and not everyone infected with HIV will develop AIDS. With advances in medical treatment and antiretroviral therapy, ART, many people with HIV can lead long and healthy lives without progressing to AIDS. Prevention and treatment. Preventing HIV infection primarily involves safe sex practices, the use of sterile needles for injection drug use, and, in the case of pregnant women, receiving appropriate medical care to prevent mother-to-child transmission. Additionally, pre-exposure prophylaxis, PrEP, is available for individuals at high risk of HIV. Treatment for HIV involves antiretroviral therapy, ART, a combination of medications that suppress the virus's replication and slow the progression of the disease. While ART does not cure HIV, it can help people with HIV live healthy lives, reduce the risk of transmitting the virus to others, and potentially prevent the progression to AIDS. Regular medical checkups and adherence to prescribed treatment regimens are essential for managing HIV and preventing the development of AIDS. HIV/AIDS continues to be a significant global health challenge, and research into new treatments, prevention methods, and potential vaccines is ongoing. Thanks for watching. If you like our videos, please like and subscribe to our channel, Mind Mentor.